So coming to question 25 of previous year NEET PG. So this is also a very big question. What will be the ideal treatment regimen to plan? So try to find out the diagnosis as we read the question. 18 years old male has recurrent fever and petechial rashes all over the lower extremities. Clinical examination shows splenomegaly. Few lymph nodes are palpable in the neck. The clinician admits the patient and orders lab tests. The complete blood count comes as follows. HB was 7 gram per cent, total count was 50,000. Differential count showed a predominance of lymphocyte, platelets are 55,000. So you can note down the clues. So what's the history is patient is having fever plus petechial rashes. Petechial rashes means it's a hallmark of thrombocytopenia. So we can take petechia. There is splenomegaly. Spleen enlarges due to various conditions. Here there is splenomegaly. And few lymph nodes are palpable. So it's a lymphadenopathy. No other clue is given clinically. Now what is the lab shows? HB is 7 gram per cent. So it is actually severe anemia. Counts are increased with predominance of lymphocytes. So it is leukocytosis, lymphocytic leukocytosis. And platelets are low, so thrombocytopenia. So after reading so much of pathology, maybe after seeing this question, one thing may look clear. This looks like some sort of hematological malignancy, right? This is some hematological malignancy. So whenever hematological malignancy comes in our mind, we always have to think of either a leukemia or a lymphoma. Lymphoma will not present with that much of blood manifestations or blood count changes, but they present with only generalized lymphadenopathy. So you know very well there is Hodgkin's lymphoma, non-Hodgkin's lymphoma. You would have discussed in your pathology. Now leukemia is of 4 major types. AML, acute myeloid leukemia, chronic myeloid leukemia, acute lymphoblastic leukemia, chronic lymphoblastic leukemia, right? Sometimes lymphoblastic leukemia and lymphomas may come together. See, it's a young age male. Only one hematological malignancy is common in young age, that is ALL, right? Second, from the clue, there is lymphadenopathy and splenomegaly. So lymphadenopathy is there. So either it is a lymphoma or a ALL or a CLL. So again, ALL can be marked. Remember, a simple tip in to differentiate AML or ALL from CML or CLL. In acute leukemias, usually counts will be low. Means usually there will be anemia or thrombocytopenia. Sometimes even total count will be low. Despite being a leukemia, even total count can be low in acute myeloid leukemia or acute lymphoblastic leukemia. Or even if the count is high, anemia or thrombocytopenia will be there. But in CML or CLL, everything will be high. That is a simple clinical clue. May not hold true always, but may be worthwhile remembering. So in this case, see, HB is low, platelet is low, only total count is high, that too with a lymphocytic predominance. So again, ALL comes there. Since other anemia thrombocytopenia is there, CLL is not the possibility. So pediatric age, predominance of lymphocytes, presence of lymphadenopathy, and if you want to go in depth, fever with joint pain will be the usual presenting manifestation in ALL. So all this points towards ALL. So what's the treatment for ALL? So even if these options confuse you, please remember any disease in our body with lymph node, right? Be it a lymphoma or be it ALL or CLL, always steroids have a role. Steroids will have a response. So most of the regimens like ABVD regimen, or many lymphoma regimens will have steroids. Okay, even if you don't remember the regimen, it's not an issue. But if you are able to pick up this prednisolone, this is the answer. Okay, what about lymph node radiotherapy? Patient has only few lymph nodes over the neck. Plus, patient is having blood changes than lymph node changes. So this is not a lymphoma, this is a leukemia. So this may not be an ideal option. So this holds good. IVG is a treatment of choice for other diseases like Guillain-Barré syndrome, not here. Doxorubicin, we don't know much about that, so leave off this option. Don't get confused with options which you don't know, right? So this is ALL.